Could you introduce yourself, your name and title, please?
I'm Rhonda Booth. I'm a research psychologist and I'm interested in disorders of the corpus callosum in my research, and I also have a background in studying autism and the cognitive profiles of children with autism. And my main job at the moment is I'm a lecturer in paediatric neuropsychology, and I'm based at Great Ormond Street Children's Hospital and at part of University College London, and I run a master's program that is helping graduate psychologists and as well as clinicians who are educational and clinical psychologists learn about the brain and behaviour.
In terms of the CCD puzzle, what piece are you trying to solve?
Right. Well, there's so many puzzles. My main focus has actually been looking at the crossover between children with autism and their social difficulties, and what we sort of see in individuals with corpus callosum disorders and the similarities in the types of social problems and social issues that they have. And the reason why is because there could be a interesting sort of crossover, and it helps us understand the differences in the brain. But also we know that there's a lot of research out there in the autism world, and where the research out there can be sort of actually helpful for children and young people with corpus callosum disorders as well.
The better interventions, better predictions, better treatment.
Yes.
You recently published an information booklet on behalf of Corpwell, and that's a UK charity supporting those with a CCD, and that involved collating research, but also communicating this to families and health professionals. So what is the most important thing you can tell a clinician or therapist? What do they need to know about a CCD?
Gosh, well, it's a really good question. Because there's so much about CCD that people are learning about. And we know at this stage that there's a wide range of outcomes, and they're difficult to predict. So once you get that initial brain scan, we're still learning about what is it in that brain scan that's different, and that may actually help us understand, how this child is going to be in 5 years, 10 years, or even 50 years' time. So it's something that we're learning about. So I think it's important for clinicians to understand and appreciate the range of outcomes and be aware of that, and of course to treat this child as an individual and to have to tailor interventions for that individual. And I think from talking and interviewing a lot of families and putting it together into that information book, one thing that I learned is that parents are often told to wait and see. So they've got a newborn child, and they know that there's something different in how the brain is developed in this child, but it is a matter of sort of waiting to see what is happening, what happens next. And I think it's actually quite important for families, or I think it's quite important for clinicians to realise that can actually be quite stressful and can actually impact on parenting and parenting style, because the parent may constantly look, and there's this surveillance, you're looking for outcomes, or looking for things that might be developing differently. So I think it's really important to support families, even if there is at that point of time the child is developing normally. I think it's really important to support the families to know what to look out for, but also to put supports in quite early on that can be really quite simple, and that can actually help parents with typically developing children as well. So very sort of simple ideas like how you play with your child and how you are sensitive to their needs and wants, and to make the child feel heard. So I think it's really important to support families and make them aware of what type of things to look out for as well, but also to make sure that they are encouraged to enjoy the special time with their new people in their lives.
The wait and see. It was on my twin daughter's neurology report. Literally wait and see, and the the uncertainty that brings, as you said, can be quite stressful. And I guess parents are often told now, take your child home, love them, read to them, sing to them, do everything you would with any other child. Is there anything else from your research and putting together this booklet that you would advise parents to do, or clinicians to advise parents to do at this time?
Yeah, as I say, to enjoy the child, definitely to look out for any problems and any sort of red flags, anything like that, go and get help and support. Find out about the condition, as much as you can. Be aware that professionals may not know that much about this condition. It is rare, and it's probably even more rare to find a clinician who's a specialist in it. So that to accept that you might be on that journey together. And that's fine, because your professional, the clinician, they'll have skills and knowledge as well that they will also bring and, to help you along that journey. But not to have that, I suppose, that expectation that, everyone out there will know and understand this condition as well.
How do parents be the best advocate that they can for their child?
To be patient, to be aware of processing difficulties, to slow down, when they work with their child, to be the best, to be the best support that they can, but also to take that forward to their educators, their carers as well, and to be that voice for the child.
And some of your most recent published work was in the Journal of Developmental Medicine and Child Neurology. And this was looking at trying to better understand just the wide spectrum of outcomes in kids with CCD and try to predict neuropsychological outcomes later down the track.
Yeah, for sure.
What was the aim of that? Why was that an important piece of work?
Well, there was a scoping review, so it was almost a systematic review of the literature. And what's really exciting is in the last 15 years, there have been so many papers now published that are looking at the same thing. They're trying to understand what it is about this condition. Are there similarities? Are there things that we can actually pull forward? And actually, is there a defined syndrome of the condition? And that's going to be really helpful, because then we'll know what to expect, and we can have something that can then go to parents and teachers. And so what Lynn Paul and her colleagues have been looking at over quite a few years is a defined syndrome. And that's with specific features, and looking at specifically poor processing speed, difficulties working with complex information, and then also problems just with the transfer of information across the hemispheres. Their work has been a lot in adults, and there's been very little work to see whether there's evidence of that syndrome in younger children as well. And I think that's really quite important to find out. So myself and a student, we big review of all the research out there, and could we extract this information? And our main finding was that it was actually quite hard to confirm the syndrome. So when a study is looking at outcomes, it can be quite narrow. You might just look at intelligence or motor skills and developmental milestones, whereas neuropsychology, that whole field of looking at the brain and behaviour and those relationships, you really need to look at it quite broadly. So that is taking into account attention and memory and processing speed and executive functions, how our daily living skills, how we plan. And we found that a lot of the research there are very narrow in what they assess. So we couldn't really validate the syndrome as such, but we did see some evidence for it. So that was a lot in the social cognition. So children having sort of some difficulties in the social domain, and also dealing with problem solving when the information gets quite complex. And there was a little bit of evidence of slow processing speed, but overall the studies didn't actually look at that specifically or report on that.
And the idea is that the holy grail, I guess, in this space is that clinicians won't just be saying wait and see. You might at least have a baseline of, well, this is likely to be some baseline struggles.
Exactly.
We still need to wait and see.
Yes. Yes.
But we can expect X, Y, Z, and starting interventions early, perhaps.
Yes. Yes.
That's what
for
you'd like
sure. Yes. And we want to understand what those building blocks are and make sure that that foundation is there. So there's no point sort of putting sort of higher level sort of, training on social cognition and how in relationships with, but if the child hasn't got good, strong attention, or they are struggling just integrating information, they need it more slowly, we've got to start at a lower level before trying to tackle sort of higher cognitions.
And is your research in this area ongoing? What's the next? What else are you doing with the data?
Yeah. So we have got some work in the pipeline. Actually, I've been in touch with clinicians across children's hospitals and fetal medicine units, where they have been collecting very early brain scans of the developing fetus. So they're actually very, very fine detailed scans now, and following these children up at sort of quite regularly at 3 months, 6 months, 12 months and 2 years, and looking at developmental assessments. And even we have permission to actually follow up these children now and see how they're doing. So what we're really interested in is, can we take those early scans and look at them in detail? And these are looking at the white, the integrity of the connections. Are there anything from those early scans that relate to the outcomes now? Can we have any firm predictions about how a child may be functioning? And so therefore, like you say, we can actually sort of put some supports in quite early on.
All power to you. Good luck.
Thank you.
Is there anything we haven't covered, Rhonda, that's important to know, either about the booklet or your most recent work?
Probably my role in the ACC world. I see myself as the person who has been looking at all the research and trying to translate that into the community and to the DCC community. So to make it sort of meaningful, to make them be aware of why we're carrying out this research, why it's important. And, we're just not interested in how the brain's developing. We're also interested in how the research can help the everyday lives of people affected by corpus callosum disorders.
Thanks for your time, Rhonda.
Thank you very much, Bridget. Thank you.